Welcome to the Dermastore podcast.
A chat about all things skincare, skin health.
And if you're a real skin nerd, we hope you'll join the conversation. Welcome to the 6th episode of the Dermastore podcast. Hey Lara, how are you doing?
I'm great, thanks Greg. How's it going?
Good.
Today's such a wonderful topic. I can't believe we're finally getting to it.
Such a big one, and especially at this time of year. But before we dive into it, let's do our little podcast tradition. What did you use this morning?
We had to actually test a new product because it was under reformulation. So we wanted to see what this reformulation was all about.
I know what okay.
So I cleansed with the Effaclar H cleansing cream. It's now called Isobiome, and that's because they've added in their probiotic from the La Roche-Posay thermal spring water.
Okay.
And it was wonderful, very creamy, very lathering. So yeah, it felt like a great cleanser. So happy with the formula. And then I just applied my ZO Skin Health Daily Power Defense, which is, I love it because it's an antioxidant and moisturizer in one. And then just popped on a Color Science sunscreen.
Oh, nice.
Yeah.
Very nice.
And what did you get up to this week?
I'm testing a whole bunch of soaps at the moment, interestingly, like bars.
Like soap bar?
Yeah, soap bars. Yeah. It's a little ongoing side hustle project, but so I actually used one of those on my face, which is not normally something I would ever do, but it actually worked quite well. And then I was still going through SkinCeutical C for Relic, so that's fantastic. The Marty Derm sunscreen, I think I spoke about this last time, so yeah. I'm still on that, but the Marty Derm sunscreen finished today, so I'll be moving on to something else.
Okay, well, can't wait to hear what that would be.
But I don't know, I might just carry on using that one. It's such a good product. So
good. Awesome.
Yeah, so very simple this morning.
Glad to hear we're wearing sunscreen in winter.
Absolutely.
Winter, I must say, this is my second winter in Cape Town, and it's chilly. This winter, I feel like it's quite cold.
And you get those beautiful days in between where it's warm and it's like feels a bit more like summer again, and then whack, like yesterday, it was just freezing again.
Yeah. So it's so crazy. And I feel like, do you feel like you've had to adjust your routine or change anything during winter?
Oh, for sure. Yeah. Definitely. I pack on the moisturizers in the evenings.
I find I have to, especially in the shower, I can't use maybe like a traditional bar of soap.
Okay.
I'm only allowed to use one specific one as per Dr. Webster. But I find in winter, you kind of have to move over to like an oil or something that's a little bit more nourishing on the skin.
Definitely.
So I find that helps a lot.
And that is actually a perfect segue into our topic for today, which is atopic eczema or eczema. And in the studio, we have Dr. Webster. Good morning, Dr. Webster. How are you doing?
I'm well, thanks.
This is actually one of your specialities, isn't it?
It is, yeah.
Along with skin cancer.
Yes, because it's a very debilitating condition, especially atopic eczema for many, many patients. So it causes a lot of misery, actually, for a lot of patients.
So you actually just said atopic eczema, which is actually one of my questions I have for you, Dr. Webster, is there a difference? Because on support, people say I have dermatitis. So now when they say dermatitis, do I take that as eczema? What is their difference?
There's no difference. So all dermatitis means is just inflammation of the skin. So the words dermatitis and eczema are synonymous. They can be used interchangeably.
Okay, so they're the same thing.
They're the same thing.
And now, for example, I was just telling Greg about in the shower because my skin is drier. I don't have eczema because I have dry skin, hey?
No. So you could just have a dry skin often leads onto an eczema.
Okay.
So a dry skin will just be a rough dry skin. If neglected, it starts itching, and then once it starts itching, then you get dermatitis or inflammation, and then it's an eczema. But the dry skin can lead onto eczema.
Okay. So that's an interesting thing that you just said there. And is that one of the identifiers that if your skin starts becoming itchy, that indicates eczema?
Yes, that's correct.
Okay.
Yeah, that's correct.
Are there different types of eczema? Is it one size fits all? Or we often see youngsters have eczema on support, so parents or moms will inquire on Dermastore support about what can they do for their kids, and we often see it on babies and in their arms and on their legs. So are there different types of eczema, and does it affect all ages?
Yes, there are. There are two big groups. We get what we call exogenous eczemas. That's from outside factors, and that's like irritant contact dermatitis. You can get allergic contact dermatitis. You can get what we call photodermatitis, so the sun can trigger things. So that's from external factors. And then you get internal, endogenous. And that's where the commonest is atopic eczema. Okay. So atopic eczema is where there's a genetic predisposition towards asthma, hay fever, and eczema. Then you get other internal types of eczema like seborrheic dermatitis, like nummular eczema, like stasis eczema. But the one that causes the most problems is atopic eczema.
Okay.
And that's more where there's people with asthma, hay fever, and eczema. And that often comes on in childhood or in infants. And sometimes it can be, some people have eczema from the day they're born to the day they die.
So they carry it through for their whole lives.
Yeah.
Wow, that's amazing.
And is there a link between dry skin and eczema, and is that an hereditary thing?
There is. There is a condition called ichthyosis vulgaris, means a genetically dry skin, where there's a problem with the production of filaggrin, which is a protein in the stratum corneum. So approximately 20% of patients with atopic eczema have ichthyosis vulgaris.
A what?
Ichthyosis vulgaris.
Ichthyosis vulgaris.
Ichthyosis means like a fish scale.
Okay.
So if you look at the people's lower legs, it looks like a fish scale.
And you said, so filaggrin, it's a genetic predisposition. They're born that way.
They're born that way.
Okay.
So they'll have it their whole lives.
Oh, wow.
And often it's quite an easy way of diagnosing whether you've got it. You just look at your palms, and if you've got hyperlinearity, if you've got increased skin markings on your palms, and you've got a dry skin, and there's other people in the family with dry skin, you have got ichthyosis vulgaris.
And what does that mean? What must I do?
Well, you've got to use the right products.
Okay. Okay, I'm learning something now. This is amazing. So actually just having dry skin it's not just because of the weather, you're actually genetically born with it.
You're genetically born with it.
Oh, wow. Yeah. Okay. Well, there are like a lot of controversial things that people talk about when it comes to eczema, and what you can use, what you can't use, how you should control it, when you should treat it, because I don't think it is just a winter condition, and I'm sure it exacerbates in winter, but I think it's like you said, we have it our whole lives, but it can worsen in winter. Is that true? That
is correct. So especially now in South Africa, in the Highveld, the humidity, it's very dry there. So often people in that they've got heaters, electric blankets, so the humidity dries out, the air becomes drier, and often eczemas are worse. In Afrikaans, they're called winter eczema, so it's a common thing.
Okay, and so the myth that I was talking about is, I know that a lot of moms also say, well, my kid has a nut allergy and now they've got eczema because of the allergy. Is there a link between eczema and allergies?
So in the past, people thought, we talk about atopic eczema, they thought it was primarily an allergic condition. And now there's a bit of controversy about all these various theories.
So allergic, like if you rolled on the grass, for example, and you got itchy skin from the grass, allergic.
So they thought it was primarily an allergic condition, but now we know it's primarily a disturbance of your epidermal barrier. So you have an abnormal epidermal barrier with ichthyosis vulgaris, and as a result of that abnormal epidermal barrier, you get exposed to the allergens. So you do have allergy, but it's a secondary phenomenon.
Okay.
So the primary problem is a disturbed epidermal barrier.
And what's that saying that you love? You have to keep the
bad stuff out and the good stuff in. Yeah.
Okay, so if you've got an impaired barrier, gaps and cracks in the skin,
exactly,
it allows for invasion of these irritants
and allergens. And you build up an allergy to the grasses.
Okay.
To the house dust mite. So that allergy is a secondary phenomenon.
Okay.
And I think in the past people concentrated on the allergies, but I'm a dermatologist, we must concentrate on treating the skin. Atopic eczema is a skin disease.
Many young parents, people, often the caregivers, just suffer as much as the patients do. What are the kind of practical things that you can give parents, caregivers who maybe have children suffering from eczema?
You must use the right products literally from birth. So as far as cleansers, certainly in small babies, I recommend a liquid cleanser. But as adults, I always say to my patients, whether you use a bar of soap or a liquid cleanser is a personal preference. But the important things are, it must not strip your skin of the normal lipids.
Because there's bars of soaps and there's bars of soap.
Exactly. It must not strip your skin of the normal lipids. It must respect the skin's microbiome and must not be irritating. So unfortunately, a lot of the soaps you buy in the supermarkets have a pH of about 10.
Whoa.
Your pH of your skin is 5.5. And some of them, unfortunately, are medicated. So you have medicated alkaline soaps, which are a disaster.
And that is completely disrupting that
Exactly.
skin barrier.
Yeah.
Okay.
So it's stripping your skin of the normal fats. And it's also disturbing the skin microbiome.
So what is microbiome? What do you mean by that?
So on our skin, we have normal bacteria, yeasts, mites that live there.
Is that similar to when we talk about flora or
Yes,
in our gut?
in your gut, and even in your mouth, So they're normal bugs that live there.
Healthy bacteria.
Yes, exactly.
Good and bad, but the good often supports the overall health of the ecosystem.
And with problem with atopic eczema, that if that microbiome is disturbed, then you get an overgrowth of something called Staph aureus.
The bad bacteria.
That's a pathogenic. It's not normally there, and that's where you get impetigo, you get boils, etc., etc.
And that is sort of a severe form of eczema.
Well, it's a complication of the eczema. So often with kids with atopic eczema, you get secondary bacterial infection.
Because I must say, microbiome has become a really big topic lately, and we've seen probiotics taken internally, and we're starting to use them topically now to help, rebalance the microbiome and the diversity on the skin with all the different good bacterias. Okay, so skin barrier function and microbiome is critical to maintain.
Yes, and pH. So those are the three things.
Okay.
You want to have you got your acid mantle, which protects your skin. You want to respect the you don't disturb the microbiome, and you want to, with your cleanser or with your moisturizer, you want to try and put the natural lipids back into the skin.
Okay, excellent. That's really helpful. That helps a lot. And you did say, though, from birth. Why is that so important?
Because, obviously, an infant's skin is more delicate, and you don't want to just disturb all those things we've mentioned.
We don't want to start that bad habit of disrupting the barrier from a young age.
Exactly, because then you're going to disrupt the epidermal barrier, and then you're going to expose the child to allergens. Then you can build up that allergy as a secondary phenomenon.
And for example, especially also if you're predisposed, so as a parent, I know that I have asthma and hay fever. Your child will most likely carry that through. So even more important from a young age to use the right products. And then, shame, does this poor kid have to keep using these products for the rest of their life?
Unfortunately, they do, especially if they've got ichthyosis. It's a lifelong thing. And often I see children get atopic eczema at different ages. The eczema appears in different areas. So infantile eczema, it's often on the cheeks. As they get older, it's often in the folds. So I've seen children that actually grow out of the eczema, but then they become hairdressers, skin therapists, chefs, and then they develop hand eczema. You've got to look after your skin. If you've got that predisposition, it's a lifelong commitment.
It's very important to reiterate that point, because people think that some products are just like correctives and they can use them once or twice, and maybe sometimes the cost factor associated to that treatment, and then they stop using it, and then you end up going back to square one.
Because it's gone. It's healed. It's gone.
It's gone.
Yeah.
But it's the ongoing maintenance. So specifically, can we talk a little bit about some of the products that we recommend on Dermastore? Avène is very powerful in this space. The XeraCalm we talked about the liquid cleansers and the bars of soap. They've got the XeraCalm bar, which is fantastic as well. I think it's got a nice skin-friendly pH. And they've got the XeraCalm lipid replenishing oil, which is also fantastic because that doesn't strip the skin barrier in it.
I mean, that's that oil I like to use. Yeah, just because it's so comforting and hydrating, and you can feel it restoring the skin barrier, or it's just nourishing.
And then the thermal spring water spray, and obviously the thermal spring water has microbiome benefits, and the moisturizer.
They're great products. And I think what is nice about them, it's a sterile formulation, so it's all fragrance free. And as I mentioned with atopic eczema, the big thing is secondary bacterial infection. So tubs are often cheaper, but we talk about pot care. So if you take the lid off a tub, you mustn't put your fingers in it because then you get bacterial contamination. So the beauty about the Avène, it's the sterile containers, airless pumps, and you can't get bacterial contamination.
It's a one-way.
It's a one-way.
Okay.
Yeah. It's
specifically for eczema because they're just so prone to that infection.
Yes.
Okay.
Yes. So they're preservative-free. It's a sterile thing, and when you pump it, it pumps out one direction. So it's impossible to get the product can get contaminated. Yeah.
Okay.
It's very elegant products.
A cream is just not enough, and you can't just buy a moisturizer. You actually need to look for a little bit more of a treatment product like the Avène XeraCalm that has the right ceramides, the right lipids. It's got probiotics to restore that skin barrier. So there's a little bit more to it if you have eczema. For example, me, I just got dry skin, so I just need to nourish the skin. But if you have eczema, the barrier and microbiome, all really, really important. When do we sort of intervene? When do you step in, Dr. Webster, in terms of eczema? Because obviously now we can recommend this to the patient online through support. But when is there a point that you need to step in for the patient?
So these products are great, and in fact, clinical studies have shown with like Avène XeraCalm, that product on its own can actually relieve mild eczema, mild itchiness. But sometimes you get to a point where the scratch cycle is so bad, and that's where we need to prescribe a prescription product like topical corticosteroid creams or a calcineurin inhibitor. You've got to try and break that scratch cycle, otherwise this eczema will persist. And
you would use then Avène in conjunction
Definitely,
with your
yes,
cortisone?
Yeah.
Okay, and then once you've sort of broken that scratch cycle, wow, that is a mouth twister. You would then maintain.
Yes, yeah. So obviously the cortisones you don't want to use for any length of time. Fortunately, the calcineurin inhibitors can be used. There's no cortisone in there. You can be used safely on the face, but that is a prescription product and it is a little bit more expensive. But the other thing maybe to mention is that there is this steroid phobia. So some people are petrified of using, or parents or patients, of using cortisone, and they're actually depriving their children of decent treatment. So I see some...
So they don't want to use cortisone?
They don't want to use cortisone.
And will anything break? Then how do you break that scratch?
Well, then sometimes you can use the calcineurin inhibitors, but they're not quite as effective as the topical cortisone.
Well, I think it's just, again, like you said, I mean, a big part of eczema for your patients is just counseling them and educating them on what their lifestyle habits need to be for the rest of their lives. And if we can start implementing these small things and changes, like using the right creams and soap, you can already make such a difference.
Definitely. It's often the simple things that are very important.
Okay, well, great. Thanks so much, guys, for that very informative topic. Thanks, Dr. Webster, for joining us again.
That was, I learned so much, actually. Thank you so much.
No, it's a pleasure. And I think the important thing is this is often a lifelong commitment. Yeah.
So you would only need to really listen to this podcast once and then you sort it.
But there are obviously other things. It's a complicated subject, There's a lot of other things we can go into, but we don't have enough time for that.
Like we said, if you just get the basics right, it's the best start you can get, basically.
Yes.
Yeah. The foundations are there.
Don't forget to subscribe if you're keen to learn more about what we have to say. We would also really love your thoughts, ideas, and any questions you have for future episodes. You can email us on pod@dermastore.co.za.